based on three premises. One, a comment by Ndile when she did mention that she expects other states to emulate the Delta example.
What you hear and what you see, I see that there's a large need for healthcare in Nigeria. That's known. The example on the beginning of the presentation of Mr. Sunday, that there are more than 34,000 primary healthcare clinics in Nigeria. Only 20% operational is well stunning, and I think there is a large thing to do. If you have the primary healthcare sector in order, in good shape, as he said, it's the foundation for the rest of the healthcare sector. And ultimately, if you do that the right way, it will be a cost reduction. Healthy people can work better, can spend more money, not on healthcare, but on doing other things. So it will thrive your economy. So having a good basic healthcare is essential for the growth of every African state.
Delayed on its universal health coverage. As you all know, and maybe for those who are not from our sector, universal health coverage is when every citizen, every individual in the community, in the country, in the geographical area, has access to affordable quality care without suffering financial catastrophe. In Nigeria, we have problems on both sides of the equation. But there are a whole lot of reforms trying to address the financial barriers. And that's why you have the massive reforms going on the Nigeria health insurance.
Because without them, and the political will of His Excellency Governor Thomas was none, second to none. There are some critical success factors to this scheme.
Ensuring access to quality healthcare service delivery across all parts of Delta State has been a significant part of the administration's smart agenda under the relevant health and education policies. The Delta State Contributing Health Scheme thus became a major and early policy direction of the government as it's being implemented as a healthcare financing mechanism to ensure access to quality and affordable healthcare services for all residents of Delta State, irrespective of their geographical location and socio-economic status.
Well, it's been very progressive. We started from nothing. We had no baseline institution of a state health insurance scheme to copy from. So we learned the hard way, but thanks to His Excellency, the Executive Governor of Delta State, and other stakeholders who had provided us that enabling environment to start off and grow, particularly the labor organizations that believed in us from inception, and the community leaders that accepted us and gave us that encouragement to get into their communities and reach out to their people for access to quality healthcare services.
The Delta State governor happened to be the cross our paths in many ways. Was my predecessors in office as the chairman of the health committee of the 7th National Assembly. And significantly, while he was chairman of that committee, that we had the National Health Act passed. Very significant because today, one of the game changers in primary health care in this country is the basic healthcare provision fund. It took us 10 years to get that act passed. It was only when it was there. So I recognize the Commissioner of Health, Delta, and all the Delta states, particularly Dr. Ben and Dr. Profeta. I've had the opportunity of being in Delta to visit the agency. So I saw when pharmacy sent me invitation. I said I must be here because I've seen what they have done, and there are several things that I was there, I think, in the year 2020 or thereabouts. So and we had a very thorough visit I saw how they are pioneering. For example, I'm sure you have gotten briefing from them on the e-health. They invested quite a lot of resources to be able to have all their release captured, very good card, and they link people that card to finance, to their banking system. So it's something that many states need to look at. I'm pleased to be here, and I want to speak for what Professor said. I'm here to be able to also listen and learn. I'm not a university professor, but I'm a student of health research, because that's what I used to do before coming to this position. So any opportunity to be able to listen to evidence that will improve planning and policy, I'm very happy to be there.
At the Delta State Access to Finance Scheme Impact Study Dissemination event, I'm reliably informed that the Access to Finance is an innovative program based on public-private partnership to revitalize primary healthcare facilities, especially hard-to-reach and underserved communities. It is my favorite talk, therefore, that this study will not only add to the body of knowledge, but also to serve as a reference for future public-private partnership to improve the well-being of good people of Delta State and indeed all Nigerians.
This is one of the things that is very dear to his heart, health financing and universal health coverage, very dear to his heart. It was established in 1999, with a view to achieve universal health coverage in Nigeria, but up until now, very few persons are still covered. So this program actually, with farm access and the Delta State, we've actually heard a lot about this program, and it's been, it's been going on well. And they've used it to achieve a lot of coverage for even the underserved communities that are in Delta State.
It's good that we have come to realize that private sector can come to the aid. There's not one magic solution to this. It's not like if government does everything, it doesn't work, or if private sector does everything, it suddenly starts to work. No, definitely not. Of course, we can also come up with examples of where private sector clinics are not working. So the beauty of this development in Delta State is that it was joint between the government and the private sector, and public, and the medical credit fund, and farm access, and the health insurance agencies. So I think we've come to a beautiful result, and the Netherlands is, as I said, very proud to be associated with this. These were the reasons why the medical credit fund was established, and I will also report back to my headquarters on the findings of the evaluation. But I think altogether we can be very proud of what has been achieved. Thank you very much.
Dr. Ben Pechika, when he'll be speaking about it. So without much ado, I just want to say that we at the Healthcare Federation of Nigeria are very much committed to working towards providing Nigerians with universal health coverage. We're working towards providing the health sector with what it needs to move forward. We're very happy that the Delta State recognizes the private health sector and recognizes what it is that we are doing in the country, and we appreciate you for doing this. We continue to work with all of the others. We also work very closely with farm access, and we will continue to work with others, and we are very willing to work with any other states who are ready to go forward and actually emulate this wonderful example.
It's a very difficult terrain, but by the grace of God, we'll be able to achieve it because of the governor, who is very, very passionate in health delivery. Went into our terrain, which is almost 95% riverine. It's not easy to access, but God giving us strength, we are able to go and deliver it to our people in the community.
7 years ago, he envisioned a Delta State where everyone will be healthy while financially protected, so that prosperity will envelop the Deltans. That's when the commission was born. Today, 6 years on, the commission has blazed the trail to be the first among equals in state health insurance implementation. I mean, they regress here. Delta State is #1 state health insurance organization in Nigeria as of today, with a release up to 1.2 million.
We are here today for the Asset Finance Program Impact Study Report dissemination. But there's a story, a journey, and an outcome that have brought us all here today. In early 2016, at an advocacy event with traditional rulers in Delta State, an elderly king, His Royal Majesty G.O.E. Temo Bini Peretri, the Agadagba of Ebema Kingdom, called me out and said that the way I'm speaking, it looks like I'm serious of what I'm saying. And I was very surprised. And I said, Your Majesty, why do you say so? He said, there's a hospital in my kingdom that was built by a multinational, and for the past 25 years, it's been locked up. And we've been asking them to please, how does it start? And nobody has ever responded to him. And he's about 90 years old. And his desires that that facility provide care before he joins his ancestors. Where is the hospital? And they pointed into the forest. And I said, where is it? They said it's in that forest. So I said, okay, they brought bulldozers and coal and cleared the place. And behold, there was a facility, big, and the equipments were all inside intact. All we did was bring in a medical technologist who checked it. And the next question is, how do we bring people to work in this kind of environment? And while we were discussing, I looked across and I saw a flat, which meant there was a flow station in that location. And I said, I'm sure in that location there are doctors, there are nurses, and clinic attendants that come to treat the oil and gas workers. If those people can go there, they can also come here. And the model is this: those people run shifts. When they come to the location, their laundry, their catering, everything is taken care of. They provide DSTV for them and all the comforts. So we should be able to do that. So we contacted Toronto Hospital, who had a team of doctors, nurses, and we said, let's develop this model. So the model we basically used was, every facility has 2 sets of people, 2 weeks in, 2 weeks out. Once they are there, all they concentrate on is providing care. We brought in generators, we brought in solar, and the doctors were willing and happy to do that. That is actually the model we are used to ensure that providers are able to go to those facilities to provide care, and the people are able to walk into those facilities and receive care. And one day a woman walked in and she said she was 7 years pregnant. And we said, why? She said that they told her she has a demon in her stomach and that she doesn't know the day she will deliver the demon. So she's rolling up because she knows the day she delivers the demon she will die. So we said, okay, we know how to deliver demons. So I told them to bring an ultrasound scan, and you know how it is when you're playing around with the scan, you'll be seeing things. I told her, can you see the demon moving around? That at the way this demon is moving, the demon cannot come out normally, so we'll have to cut you and bring it out like we did the other women. And she signed the consent, and we brought out a massive fibroid. It was so bad that the solution was a total hysterectomy. But these are the few success stories and more we've had.
Especially what's happening in Delta State. We got interested, and I must tell you that the Obio Health Facility, which our Honorable Excellency Chief Elue is referring to, is being managed by the Society for Family Health. You'll be busy walking, and then you'll see 2 or 3 vehicles driving, and then Dr. Ben Nkechika is in your facility. Or Dr. Oke or Dr. Alfred Ibiakofa is right there. And that's direct supervision. So you must be on your feet every time. You must be, on top of our game. And that has made it very very attractive to the community, the rural communities that we serve.
Surprisingly, it's the vision of the governor, because it was his baby desire to provide quality healthcare to all residents of Delta State. It's been his ambition while as the chairman Senate Committee on Health. So we realized that we had a mandate, we had a vision, and it was our responsibility to deliver that vision of the governor. So with his strong political will, with his able support system he made available to us, we had no choice than deliver. But another important factor is the fact that whenever you have the opportunity of giving back to the society, it's always very refreshing and rewarding. And that was a secondary drive for us to work hard and achieve the successes we're celebrating today.
Well, I think it's innovative, and there are lessons to learn for scale-up and replications. Of course, as an health system person, I've had the opportunity of studying options like this. I think what came to my mind is what I've seen in Cambodia. I was in Cambodia 2006, but of course that one was donor-driven, what they call contracting in and contracting out system. So it's a similar thing, because what you see here is that you see government trying to provide health for its people, particularly those that are hard to reach, those that who are not accessible or who don't have access to normal health care. And they know that normal government system cannot deliver that. So they bring in the private sector. So the government owns the facility, the government guarantee the finance, and the government also created business opportunities for them, because there's insurance and element. Because the government established the insurance scheme, managed the insurance scheme, and now pay the provider. That means they deal with both sides, as we said, supply and demand side. So it's a very good lesson, and I can see it being replicated. The key things which I see there, where there will be challenge, is if it has to be like some people are suggesting, if they have to do it in an urban area, there will be resistance from the unions. Because it means they are handing over facilities where you have doctors, nurses, all health workers recruited by government. You get my point? And then they will move them out of these places, because if they have to give it to the private sector may not retain those staff, or the staff also may not want to be retained under the condition of the private sector services because of pensions and also on. So, but it's something that could be replicated for areas that are hard to reach, areas that are unattractive to regular government workers. In which case, by that, we'll be able to reach the unreachables and be able to bring in on board those people into the main healthcare services.
We are specialized in providing turnkey projects in the healthcare sector, especially in sub-Saharan Africa. I'm very proud to have been part of this session with Farm Access. I'm very impressed by the level of commitment of the various stakeholders in this project, which is necessary to have this private-public partnership project brought to a success. And I think that is an example that could be used in the rest of Nigeria, but also in other countries in sub-Saharan Africa, and I hope to be able to be part of that.
It's exciting to be here to see a great thing done by Delta State in partnership with pharmacists. So this is really something we want to push to the next level. These success stories should be emulated and then scaled up. That's why I'm here. I'm so excited to see how can we participate in making sure this become a bigger thing, impact in Nigeria. For me, it's so exciting to see how PPP can transform, can make both economic and social sense, really. You see, for us to see a run-down hospital or healthcare center, there's no other way of getting them back to life. Now to see all the players coming together, the private sector, the funding agencies, the government political will to make it happen really is an amazing partnership that we need to really study more and see how to make sure that it becomes a model for Nigeria to revive its healthcare system, because our healthcare system is in a very bad shape, and this gives us hope that we can get it back to shape. Because this kind of arrangements that is showing successes, we need to see how do we push it forward. Other states, because in Nigeria we have among the worst healthcare systems. Government cannot support everything. But if you put the infrastructure in place for everybody to participate, to make sure we have what we have here, in other states too. So we're so happy to have it. In anything to happen, for anything to happen, political will makes it happen. And I'm so excited to see that political will in Delta State. I mean, maybe because the governor is a doctor who has been in Senate, who has seen who understands it. Most times, there's no political will, there's no understanding. You have seen the picture. You know that role he plays is so critical. And I'm hoping that other state governments can see this. There are many people who are willing and ready to support. If that political will is there, it can galvanize all the resources we need to make it happen. So I'm so happy, and I'm hoping that Delta State should. The project is beyond here. People will see that this is happening. So even at the federal level, we have so many hospitals that are not performing. They're also economic centers. So how do we combine economy, social, and political everything together to make sure that we have healthy citizens? Without healthy citizens, we cannot move forward.
Not just because he's a medical doctor, but he has the knowledge or inspiration of what he wants to do for Delta State and Nigeria as a whole. I can say, particularly for this program, this health insurance thing, it's a big plus for him and for us. And so we are cooperating maximally in our rural areas to ensure that this bright idea, this innovation, gets down very quickly to our people. And so we thank him for being there for us. We thank him for being such an administrator and a believer in what he can do and what he's able to do. I think God is clearly using him to better the life of our people. This, the journey of 1,000 miles starts with out of 36 states and the federal capital. Delta State treading the brave. So I believe that with Delta State's success, the benefits of healthcare and good governance will go throughout this whole country. I believe so.
It's a success foretold, except that the dimension it has assumed is way beyond our expectation. When the state started off this project, like the manager said, Dr. Akbaveta and Dr. Obed, the chairman and the DG respectively, we were focused on health for all Deltans. If you realize that the same governor who as a senator moved the bill for Health Act, which has transformed the landscape. So all he needed to do in Delta State was to domesticate it. We believe that the way to go is universal health coverage. And unless you have that insurance scheme, which has lower cost components in terms of capitation and coverage, you will not get far with what you want to do. There are a lot of undercovered areas and uncovered areas, and we needed to make sure that we do both the urban centers and the very remote areas. Yes, we're in excess of 1.2 million today, which is significant because the target before he leaves office was 20% of the population of Delta State. This was after our tour in Rwanda, when we went on to study the primary healthcare funded by UNICEF. But you will agree with me that we will do close to 25%, which is very significant. We found out that our local funding as a state has a lot of limitations, and then we decided to do private practice, PPP, and that PPP has worked significantly. The icebreaker is pharmacists. We created access to other private sector practitioners to play in this same space. It didn't come without challenges, enormous challenges, but they would have the storm. And today, it's a huge success story on how we can partner with the private sector to do that. Pharmacists has provided the cash backing for BOI to lend Naira to healthcare providers to deliver on the services. Capitation is low, but I can tell you it's a volume game. If you drive, as you can hear the testimony, some say they run as high as 5,000. As I speak to you, everybody on our SIP program in the state, the government is trying to migrate all of them to this program. So the informal sector is going by the day. Our maternal free antenatal care and pre-maternal care and under 5 that existed during Odua, it has been incorporated. What this government did is to expand the scope of health provision and make it increasingly less dependent on government to provide all the facilities. I have no doubt in my mind that this program will remain a template for the federal government to intervene. And this is part of what the state, Governor Kowa's ticket in conjunction with our principal, Atiku, will bring to the table. It's a good story because you have a lot of international buy-ins. A lot of donor agents are all over the world looking for how to improve on this. Delta has provided the platform, and it's an acid test for them. So today, the DGs all over the world speaking to people who are interested, and they're beginning to understudy the system to see how it can work, not just for Nigeria, but also for African countries. So I commend the governor. He's not celebrated on this in Delta State, but he's celebrated on this score in the world, by the world. So a prophet is not always acceptable because of issues of politics, but take it or leave it, believe it or not, this is another template, apart from job creation, apart from rural infrastructure that he has put on the table. So we're very happy and very proud that the world has come to celebrate him here, and he has created a template, not only for Nigeria, but for Africa.
Well, it's extremely impressive, and it goes to tell all of us that there's light at the end of the tunnel. Our people deserve the best. And like I said earlier, COVID-19, if not anything else, should have taught us one or two lessons that healthcare is primary, healthcare is real. At the point where the whole world was closing the door at us as Nigerians, and indeed as Africans, time for us to take ownership of our health becomes imperative. So this today is a good driver in the right direction. The fact that if Delta can do it, other states can emulate. Same, because without a doubt, government can run hospitals, and hospital services should be done in such a way that there must be collaboration with private entities. And until we begin to look at those narratives going forward, having been managing hospital services for over 4 years now, I have seen that government-centered care is always a challenge. When you have your recruitment process that you can control, when you have level of productivity that is reducing by the day, when you can control in discipline, when you can control all sort of indiscipline across the spectrum of service delivery, you need to have a system that should be able to be responsive enough, because the bottom line is lack of productivity or lack of commitment by staff translates into poor quality healthcare services to our people. So until you have a way to measure performance, have a way to benchmark productivity, have a way to make sure people do what they are meant to do, we're wasting our time in this country. So this is a good initiative, and I believe that a lot of states should emulate same. And let's see how that changed the narrative of healthcare services in this country.
Partner to the Delta State Contributory Commission for this Access to Finance program. Incidentally, I'm part of the core team that even started the program from the farm access perspective. So from beginning we bettered the whole program and saw it to what it is today, and we are very happy for this dissemination to showcase what has been done in the past 3-4 years on this program, and of course where to take it to the next level so that other states, federal government can actually adopt this model, and whatever shortcomings that we have, whatever mistakes that we made can be addressed and enhance it, so that the journey for universal health coverage is real and achievable through public-private sector engagement. So it's a laudable program. I'm happy to be a key stakeholder in this, and I'm hoping that this message we have tried to disseminate will not just end here, but people will adopt it, people will ask for how to grow it, or even ask for how to create better models that can actually move private-public participation, and of course, ultimately, healthcare provision and better health outcomes for Nigerians, citizens of Nigeria, especially in the difficult communities and hard to reach areas. People say that where there's a will, there's also a way. So it's not been an easy journey, but of course the state has always tried to make sure that every step of the way they are ready to tag along. There are difficult moments, difficult decisions that need to be taken, but all was towards progress of the program. So it never truncated. That's the good part of it. The challenges were there, the difficulty to access something, some unexpected issues actually came up. But then there were, heads were put together to find a solution. So while the framework was an overarching framework, when you start implementation, of course, your challenges will also come up. And once you deal with it and you have lessons learned, you now establish a better way to navigate. So it's been growing. We had 15, as at the moment we can count for 15 public-private facilities that have been revitalized and are running, so community engagement was key. And so when Delta State ensured that for every time we were going to establish a new center to start operations, community engagement was one key factor that we realized and factored in. And what that does is to help even the private sector providers to have better engagement with the community and more, safer environment and operational excellence.
It's been a wonderful experience. It's the way to go. It's a privilege to be able to serve those who otherwise will have not had access to healthcare. It's very rewarding, at least in terms of emotional benefits. And I believe that in the long term, it will be financially rewarding as well. We are creating employment, we are looking after children, we're looking after pregnant women. Since we set up our own center 3 years ago, we haven't lost one pregnant woman. Babies are delivered regularly in the hospital, and it's a good experience.
Private partnership has been a very, very interesting new area of healthcare delivery now. It's about time for it to happen. We are happy to be part of the project. It's a novel project. There are various other aspects of it that has been helpful to provide better healthcare to the local community, and also for us has also increased our expertise and knowledge on providing healthcare to the underserved members of the community. So it's been a very interesting relationship so far. We have been able to keep up with our game because the government has been monitoring quality service from our own end, which is where the private sector falls in. And for also the government parastatals, dealing with the private healthcare organizations has also helped them understand better the needs of a revenue generating organization like the private healthcare. So the relationship has been quite good.
I came around to not just witness, to be part of what is going on, because actually the main issue is all about universal health coverage and access to finance. How to achieve the sustainability in terms of making quality, affordable healthcare available, not just in Delta State, but to Nigerians. From what they've just said, which is very significant, in Nigeria, after so many years, since 2005, we've been able to just reach 4% of the population. From what we gather here now, that means in Delta State, they've covered 1.2 million, which they say is about 25% of the population. So that's a giant stride. And we also heard that issue of innovations they've made in trying to achieve that. So it's commendable, and they won a lot of awards. UNICEF has also commended them, and you can see what is happening. The farmer access, the Dutch government is supporting them, and so many people from the federal government are here to really acknowledge that they are doing well. We must mention the issue of the executive governor of Delta State, Senator Dr. Ifeanyi Okowa. If you remember, he was a chairman of the Senate Committee on Health, and he was part of the team that made the 2014 National Health Act, for it to be passed and signed into law. And that's what brought about the Basic Healthcare Provision Fund that has helped in terms of financing healthcare in Nigeria. So we hope that what Delta State is doing can be replicated in terms of national insurance scheme, so that they can move from the 4% or 4.something% now to over 30%, not just 25%. That's what we're hoping.
The challenges are quite formidable. Some were anticipated, some were never imagined. But the good part is that because our vision was always at the goal, we did not let the disadvantages and the challenges affect us. So we developed a spirit of that whenever challenges come, we either overcome them or we manage them. And that has helped us. A very significant challenge was the fact that convincing people to believe that government will work was a problem. We came from the private sector. I'm from the private sector. So I've always had the mindset of getting things done. And to now imagine that despite your effort to get something done, everybody believed it will never be done, it can never be done, was a bit daunting. So it took us time to convince them that no, this is a different system, this is a different dynamics. Just believe in us and we'll put in that effort. So that was a very critical challenge. Also, there was this situation where the existing situation that, when you want to change something is always difficult. So we got a lot of resistance to change. But over time, we're able to convince them that change was better than having the status quo that was not very effective and productive. So that spirit to ensure that whatever challenge we meet, we develop the spirit to overcome it, or we manage it till we can overcome it. That's what has kept us going.
Yeah, well, this is one of the questions I asked in there, because truthfully, the issue we have at hand, people not honestly trusting politicians and essentially not trusting our policy. The second level is, even for those policies, how has it been implemented? So implementation and policy making are critical. But what I can gain here today is the fact that we need to begin to do engagement, grassroots engagement. Let people begin to see that what you're about to sell to them is, it should be evidence-based. It's something. So for what has happened in Delta, we can make reference, and other states can make reference to that and see that. Go and see what is happening in Delta. Go and inquire how their healthcare services are transformed from where native bath attendants and traditional bath attendants or people with less clinical experience had really caused death to a lot of our mothers and children, and see how that has transformed because of this initiative. It's always good you have a reference point. With the reference point, you can begin to have an evidence-based argument, and people will begin to trust you more. But for something that's never happened before, it is difficult to really tell people that this is really going to work.
Like I said, political will is the foundation, the bedrock of this success. But I think if we recap what was being pointed out, we must have a solid health insurance system to be able to ensure money flows out there. We must have a viable private sector that knows what it's doing, so as not to just bring anybody, but they'll bring their efficiency, which is what the key driver. And then you must ensure that everybody is accountable. So that means there must be some form of technology that accounts for drug expenses, that account for services that are delivered, so that at the point of making claims, claims and there's little or no disparity or dispute, and then payments can actually flow in. So these are very key salient structures that must be put in place for a perfect public-private partnership. And overall, government must take responsibility and ensure investment protection for private sector, either by policy and also by implementation factors that the private sector providers will encounter.
Talk about demand and supply. Well, from the demand end, one is from the community, having the right number of enrollees, having community awareness for them to be able to access the service, which of course is why we get paid. We get paid for the number of people who get on board. So from that end, of course, we had to be involved in a lot of community mobilization. We had to be involved in a lot of community education to explain and get them to be able to access this service. So that's also been very interesting. We've gotten a lot of buy-in from them. We have better relationship with the community leaders, the obas and all that. And from the supply end, of course, being a new project, we also had to first develop a minimal viable products. What are the first initial basic services that we can render? And then we are scaling up from them. So it's been an interesting experience, being able to monitor providing the needs based on the current demand, just to meet the current demand. And as the demand has also increased, so also as our own services, the level of our services has increased to meet up to that.
I think first is the partnership between the private sector and the public sector. There has to be a willingness, there has to be mutual understanding and respect, and then the access to finance, because accessing finance is a huge problem for the private sector in healthcare in Nigeria. But under the scheme, we were granted access to relatively cheap funds to be able to start, and I think that was very helpful. It would be nicer if it was cheaper, and I think that's a very important thing to do.
So, like I mentioned earlier on, most of those things, if you even ask me some things that made it work, I don't know. Like I said, situation just happened, took a decision, got it done, overcame it and just moved on. So to say I should start listing particularly the success factors, I might not be able to, but when you talk about the success principles, it becomes more formidable. Like I said, the first thing is come open, come clean. Talk to people, relate to them on an equal basis, not government, subsidiary, or no. Talk to them on an individual basis, and that helped us build trust, build communication. Two, ensure you have your facts and figures. You have that empirical data, information that says, I'm going to move this from here to here. This is how I'm going to do it. This is where it has been done. Or this is, despite the fact that it has not been done, this is how the situation will be done. Once you break it down and present it, like when we started this program, and we spent quite a while documenting it, planning it. By the time we came up with the product paper, the framework, and the implementation guideline, we had these 3 documents presented from day one, and we said, this is how we're going to do it. And we gave it out to experts to scrutinize it, critique it, and they said it was perfect. I mean, not 100% perfect, because when you now start implementing challenges come, but they said it was a perfect document to start with, and we presented it to everybody. So if people understand the fact that before this program started, there was an economic management team set up by the governor of about 15 experts, talking of professors and co, who looked at it and recommended to the governor. After that, another set of people went through it, and then it was passed on to us to implement. So if you look at the processes we have gone through, you will see that we didn't just wake up and start. So when you now say, what was the critical factor? Is starting well, documenting well, having a clear-cut documentation. That is the first part. Then every other thing are things that are the unforeseen situations that come up that you obviously overcome. But your foundation must be very strong, very solid, very formidable, and should be scrutiny-free.
Oh, certainly, like I said earlier, it is the way to go. I think the way we will eventually achieve universal health coverage will be through private-public partnerships. That's the only way to do it, because otherwise health is a social service, but it's a huge cost to the government. But managed properly by the private sector, then it will be both cost efficient and cost effective.
We've said, I was going to borrow from what Dr. Ben said, the impossible became possible. So I believe that's also what other state governments need to take on. The tax is very daunting. It has a lot of fraught with a lot of challenges. Interaction between government agency and private agency, it's not the usual practice. So, but what Delta State has been able to prove now is that this is possible. So because they've shown that it's possible, we know that it's not perfect yet, but the fact that there has been an engagement, there has been clear benefits, there has been clear operational improvements in this regard is something that will now allow other state governments or other agencies to take on this challenge, and definitely we expect that we'll get more improvements across board. So I'm particularly very excited about the whole project. I'm focusing more on the effect that it's having on the communities, and if we look at it, for every single life saved is what all the revenue one can possibly ever want to achieve. So we're happy because you don't know if the life you've saved is the next governor or the person who can change the society for good. And the other advantage of the program is that it also gives them more confidence and trust in the government. So it's one thing for the government to have the thought of providing better services. It's another thing for the community to see that impact of what they have as a desire. And I want to commend the Delta State government and the scheme for what they've done, because now they've been able to show the community that what they think about them providing access to healthcare is doable, and they're able to bring it better to bear. So I think it's been a wonderful project.
The reason people look at it as mystery of magic is because they don't even understand what it is. Public-private partnership is like husband and wife. The wife has come from somewhere, the husband has come from somewhere. First thing first, how are we going to live together? How are we going to understand each other? There will be quarrel, how will we settle? So long as that understanding is there from day one. One big issue that always comes up is the issue of trust. Government has some concern that the private sector wants to grab and go. The private sector has a fear that government will not keep to its words. So what does it say? I'm government. I guarantee I'll keep to my words. Private sector, guarantee that you'll be considerate in your charges. Once you break that ice, every other thing is easy. We always advise people, don't replicate our template. Look at the principles and adapt it to what you do. Because the challenges I saw in Delta State may be different from the challenges in another state. But once the principles are the same, and what are the principles? Are very basic. Treat everybody equally. Be open, make sure you do your groundwork, make sure you're straight and sincere with the people, and make sure you have all the capacity and the indices that will create that enabling environment for all parties to be on the same table and cooperate, discuss, and agree. Even if while on the same table there are disagreements, let it be that the disagreements are based on an understanding. And once you do that, you'll be fine.
Not just Nigeria, the eye of the world is on what is happening in Delta State. How much of pressure is that placing on you?
Surprisingly, it's not pressure, it's actually a stimulant, because now we know that, you see, when you do something and it's recognized and it's appreciated, and you get that support, it's amazing. So the foreign recognition we're getting is not just recognition, it's actually efforts, attempts, and action to help us achieve more. So we're not just getting recognitions, we're getting strong support, both in terms of capacity, technical capacity, in terms of financial capacity. So we're actually being properly encouraged, and it's not something that should worry us. It's not a daunting task. It's something we can easily achieve, and it's actually very supportive.
Based on three premises. One, a comment by Njideka Ndidi when she did mention that she expects other states to emulate the Delta example.
I will tell you that he's fully hands-on. You don't just take things to him and it just passes through. You have to prove your point. When we started this health insurance scheme, I'd never forget, he had just won the primaries. And I prepared the position paper. That's just concept note. This was a 2-page executive summary. And I walked into his house. He was having a meeting with about 15 to 20 political associates. As soon as we walked in, he told them to excuse him, and he came to us and he listened. Attentively made comments, finished, put in his words, and went back to the political meeting and said, now go ahead and start. You cannot get a stronger political will. So that is the critical thing. He's very detailed, very critical, very knowledgeable, and that has helped us. So in terms of getting things done, he gets things done. But he doesn't just get things done by word of mouth. He ensures that that thing is done effectively, and is done as has been said it to be done. And that's why they call him a Kweme.
The impact of scaling this model across to other states is finally being able to attend to the needs of the underserved members of the community, able to spread out the demographics of healthcare providers across this society. Because on an average, when we count the number of healthcare practitioners we have, most of them are concentrated in towns. And that doesn't give you a true representation of the number of people to healthcare practitioners, because they are concentrated in certain areas. But providing this kind of scheme now, where it's trying to serve the unreached members of the society, then you can have a more equitable distribution of healthcare practitioners and healthcare services. So looking at it from that perspective, definitely it's been helpful.
Good to keep politics for politics. Let's play politics when there's need to play politics, but let's also empathize for Nigerians that really need. Because when you're playing politics and you want to get vote and all that, it's the same people that you need to give them, at least keep them alive if you need their numbers. If you really need their numbers, provide healthcare, keep them alive, make them happy, make them realize that you are a government of continuity, a government that really cares about what really matters. So what are they asking for? Better health. When they get pregnant, let's be able to deliver, let the child be healthy. If we have injuries, sustained injuries by our trade or whatever we're doing, let's go somewhere and get quality healthcare. Nothing more than that. So you can play politics at the high end, and maximizing your potential in politics. But when we come to the grassroots, let's play the politics towards ensuring infrastructures that make grassroots living works. So we can put politics one side, but you can infuse it and don't play politics at that level.
We're all politicians. Once you're a human being, you're a politician. The question is, what guides your political decision? Is it political politics, or technical politics, or outcome politics? The key point is, what politics are you playing? We're all politicians. So for what I know, is politics about getting things done the right way, the proper way, for the benefit of all, and as we have agreed to do.